This walkthrough covers the patient proforma in PRISM, the visit screen where the whole consultation is recorded. We open on the home dashboard, go into Patients, open the patient from the registry, and start a new visit from the profile. This is the visit screen. The tabs across the top move between sections. The status shows the visit as a draft until it is completed, and everything is saved as you go. The actions on the right: print or email a prescription, open a summary, switch to the visit list, or complete the visit. The first section captures the chief complaint, one short line for what the patient most wants addressed, and the symptoms, picked from the master list, each with its duration and notes. The clinical history follows: past psychiatric and past medical history, family history, and personal history, with premorbid personality and any allergies. These fields are stored on the patient, so editing them here updates the history on every visit. The history of presenting illness takes the onset, cause, and severity as free text, with a microphone icon for voice entry. The physical examination records vitals, with height, weight, and a calculated body mass index, a general examination from quick selections, and a systemic examination grouped by system: cardiovascular, respiratory, abdomen, and central nervous system. Systems that aren't relevant can be left blank, and empty fields don't print. The mental status examination is built from quick selections: speech, mood, and affect, then thought and perception, a suicide risk assessment, and insight and judgment, with notes for anything a preset doesn't cover. In the diagnosis section, you pick the diagnosis by ICD code or name and add notes. Each row can be marked provisional or final. Investigation results records values the patient brings back from outside labs, with each flagged against its reference range, and documents can be attached. The scales section administers standardized rating instruments, such as the PHQ-9 for depression, which score automatically. More scales can be added from the library. Substance use captures the pattern of use for each substance, type, age of onset, quantity, and frequency, along with current and past withdrawal and any complications. The form expands only as you fill it in. In the prescription, you add a drug row from the master, which fills in the strength, schedule, and route, with patient instructions and clinical notes. A do not substitute option and taper steps are available, and counseling can be noted for the visit. Investigations to-do lists what the patient should complete before the next visit. These appear as pending results on that visit. A notes field holds the plan and any side effect watch points. Documents lets you attach scans and photos for the visit, consent forms, external reports, and referral letters, and the follow-up date is scheduled here, defaulting to the clinic standard interval. Sections switched off in workspace preferences appear under hidden sections, ready to be toggled on. Linked reports open on their own screens. The psychological assessment report records the testing details, reason for referral, background and behavioral observations, the tests administered with their scores, an impression, recommendations, and a sign-off. The therapy report captures the session details and method, the participants, objectives, and techniques, the key issues discussed, a plan for the next session, and a sign-off by the therapist and supervisor. Each report can be printed or downloaded. Certificates and referral letters are issued from the same place, with the patient, doctor, and clinic details filled in automatically. A disability certificate takes the relevant particulars, and a review step shows the finished letter before it is issued. Once issued, it logs for editing. A specialist referral letter works the same way. The referral details and an autofilled clinical summary, then review and issue. When the consultation is finished, you complete the visit. Back on the profile, it now appears in the history with the diagnosis shown. The patient profile gathers the demographics, with quick actions to add or view visits, schedule an appointment, edit the profile, open the activity log, or merge duplicate patients. Editing the profile updates the stored clinical context, informant details, and notes. The activity log is a full audit trail of everything done on the record across visits. And merging duplicate patients consolidates other records into this one. Their visits, appointments, invoices, payments, documents, and wallet balances all move across. The duplicates are soft deleted, and the action is recorded in the audit log.